But I'm going to introduce Joanna first, who's going to talk about the links specifically between health and education, and looking at comprehensive sexual education as a case study for that. So Joanna, thank you very much.
Thank you so much to the organisers for the invitation. We're really delighted to be here today. I'm based at UNESCO headquarters in Paris. I'm sure many of you know UNESCO for the World Heritage and the ancient buildings and cultural protection, but we also have a really significant area of work on education and supporting the strengthening of education around the world, and that I think is quite appropriate now with our universal goals. Laura, could I just have the... Please. Thanks. No, that's fine. Thanks very much. I'm going to have a slightly difficult time in some sense separating my presentation from what Brad said earlier. We come very much from the same field. Anthropologists who work at the intersection of health and education. So I'm going to try not to repeat. You'll find that some of the messages are exactly the same. I hope you all find that deeply reassuring, that the wider community agrees on so many things. You might find that there are some things that we differ on, which I hope is also reassuring because we are human after all. I think one of the differences, and perhaps you'll see this here, is that UNESCO is one of the founding co-sponsors of the UNAIDS programme, so the UN's response to HIV and AIDS. And our particular responsibility in that partnership is to work on education and to work on education within the HIV response. So a lot of the work that we have supported over the years and the guidance and the normative frameworks, but also the programme support at country level, comes from that background context of supporting HIV programming. It's broadened out an awful lot. Brad mentioned the work on FRESH, overall approaches to school health, but we are very mindful that that's part of our background. And I think we all know that the HIV response has really heavily influenced health systems overall, but has also influenced other entire sectors, including the education sector, in the way that it's responding to that issue. So we're really working in an era where education and health are incredibly high priorities, and they're top priority topics for a huge number of countries, of bilateral partners, donors, and there's partnerships being created all the time to establish how we can work more effectively on these issues. Brad mentioned the SDGs. I'm only referring to a few of them here. We talk a lot about health, education, gender equality. But I think one of the things that is really important for us to be reminded of is the SDGs is a universal agenda. We're not just talking about a development agenda here. We're in Europe. These SDGs apply to us in any of our countries as much as they do in other parts of the world. So let us also bear that in mind. And all of these issues we have health issues which may be new and different. We're looking at mental health, we're looking at obesity, nutrition, where we could find ourselves working in countries where there are both obesity epidemics and malnutrition epidemics happening at the same time. So we need to be thinking about those issues. In Brussels here, with the EU, we know that health and education is a priority for the EU and a lot of its individual members. There's through the Gender Equality Action Plan of the EU, there's a commitment to sexual and reproductive health and rights, which includes education. So we can see in these policy and normative frameworks spaces for us to be working on these agendas and these issues. And in fact, I'm grateful, and we, I think, as the UN community, appreciate the EU's strong statements on comprehensive sexuality education. And then, as the UN, our responsibility to working with countries, representing countries and supporting countries to enhance and strengthen their health and education responses. And as I said, for us at UNESCO, intersection of health and education. And this concept of intersectionality, I think, is going to be really important for us in the coming years. Education, we're seeing it and hearing it so often. It's a foundational component. We hear people saying this is going to be the key to leveraging success in the job market or in health or in addressing poverty. I think another way of putting it is that everybody wants a piece of education at the moment, and quite rightly so. It's absolutely critical. But we also need to be asking ourselves the question, how much responsibility and how much weight can a sector which has historically been very, very underinvested in, how much responsibility and weight can it really take, and how quickly? So I think that for me is an overriding question. I've referenced here a couple of key sectors: health, gender equality. We've mentioned the close connections, getting girls in schools, the lifelong and intergenerational benefits of educating a girl and how that impacts on her, her direct family, and then in the future if she herself has a family as well. Child protection. There's a lot more discussion now about the role of schools and the education sector in child protection, in preventing violence, for example. And of course we know that education is instrumental for economic growth. So I think the only way for us to really ensure that all of these apparently very impressive dividends are realised is to really identify the effective content and to strengthen the overall education system to be able to cope with these increasing responsibilities. So it's complex, and complexity is at the heart of what we need to be working with, and we need to embrace that complexity and nurture an approach that, from my perspective and from our perspective, in a UN agency, is one that promotes partnerships and collaboration. Otherwise, we won't see the results we need. There are a number of global frameworks and guidance that can help direct us. Brad earlier talked about some of the historical conventions and statements that give us the basis from which we can work from a policy or a legal perspective. But there's also, even just in the last 12 months, and these are examples of guidance, evidence-based guidance that have come out just in the last 12 months that look at these intersections and the importance of investing in education in order to reap educational benefits, health benefits, or other kinds of benefits. So, for example, there's a big push on improving adolescent health at the moment. I think many of us are aware of that, but looking at the holistic issues facing adolescents in their health, and specifically, so beyond sexual and reproductive health, everything from violence to road safety. Still, diarrheal disease is still one of the major mortality factors for younger adolescents. But as they get older, violence and maternal death is also. So the Global Accelerated Action for the Health of Adolescents is a document prepared by a number of different organisations, UN and other, and education is one key response factor within that. Inspire, 7 strategies for ending violence against children. Are people familiar with this document? No? Yeah? Great document. Again, education, one of the 7 strategies. So here's another sector that's taking a comprehensive approach, and it looks also at communities, it looks at policy level interventions, looks at the more kind of social protection efforts, but education is in there. And then finally, just recently, many of you may be aware of the newly released Guttmacher-Lancet Commission report, which looks specifically at sexual and reproductive health and calls for comprehensive cross-sectoral responses. Let's no longer just talk about maternal health, just child health, just abortion, just contraception services. Let's look at it holistically, and comprehensive sexuality education is one of the 5 key programming areas within that. This is just in the last year, and these are all on the basis of enormous and rigorous evidence reviews. So we know that we have the evidence for that. And let's not forget education. And this is a quote, in fact, we have there the GPE action plan. Gender is one of the core components of the Global Partnership for Education's action plan. I've also shown a shot there. The Global Education Monitoring Report, which is one of the key documents within the education community for monitoring progress and highlighting challenges. A gender review is part of that every year, and increasingly in the report and in the gender review, we're seeing analysis of the issues of early and unintended pregnancy. Why are girls dropping out of school? Gender-based violence, how's that affecting the achievement of both girls and boys in school? And also child marriage, menstrual hygiene management, and other issues. So we're seeing this view being taken on board. So when we talk about education, I want to be clear that we are talking about a whole school approach. We're not just talking about what's in a curriculum that someone delivers after school for 6 hours to 13-year-olds, yeah? So we're talking about the quality of the teaching workforce. Are they trained? Are they supported? Are there policies in place at the national level to make sure that the wide range of different educational content and the safe space is being delivered? And also, is the school learning environment safe? This, if we have those things in place, we know that that can lead to knowledge improvements. That's at the heart of education, of course, but also the attitudes and values and the life skills. And this is what's interesting in the SDG agenda, is there's an increasing focus on life skills and those other, what used to be called soft skills, for achieving well-being and human development. So ultimately, we can see a transformation in the outcomes for young people. So we're talking about information, education, but then also the environment. So when we talk about life skills, and I will just leave this text here for the moment, but when we're talking about life skills, we also need to be thinking about social and emotional learning. And I'm sure that many of you, there are 60% of you, I think, in the room who see themselves in the education sector. So we all know that this is work. There's an enormous amount of work ongoing to develop notions and understanding of how social and emotional learning can be delivered through education. But some of the things and some of the words I think we need to be taking from this are the shifts in teaching practice to create participatory spaces where young people are empowered to learn and to engage critically with the learning process and to develop skills that are useful for the workforce. Oh dear. Well, there was a bit of self-management. I tried. I apologise. I will take a few more minutes. But that we can see that social and emotional learning, and if we invest in these kind of broad-based skills, will reap dividends that are around gender equality, workforce, this capacity of young people to engage in the changing workforce of the future, and also health and social development. I'm going to talk to you specifically now about comprehensive sexuality education. For us at UNESCO, it's a really core part of quality education. It provides a source of learning and information about key health issues. It provides a space for young people to develop those values and skills that I just mentioned. And it covers a huge range of topics and issues. It's not just about sex. It's about your body, bodily autonomy, gender, staying safe, relationships, families, sex, consent, pregnancy, HIV, huge number of topics. Earlier this year, we released at UNESCO with UN partners a revised edition of the International Technical Guidance. Copies are outside the room, so I would really welcome you to pick them up, have a look, see what's in there. It follows the same format as before, which is that it presents an evidence base for sexuality education, and we hope that's useful to all of you who are advocating for comprehensive sexuality education. And it also provides the overarching recommended concepts, topics and learning objectives for 5 to 18-year-olds, and we'll come back to those age groups. Young people are facing a lot of issues around the world at the moment. In some parts of the world, 2 out of 3 girls have no idea what's happening to them when they begin menstruating. We know that approximately 250 million children a year are subject to some form of violence, probably gender-based violence, in or around school. It's a very inaccurate estimate, and the numbers are likely to be much higher. More than 1 in 10 girls have experienced forced intercourse or sexual acts or other forms of intimate partner violence at some point in their lives. So there are a lot of issues that young people are facing in all countries around the world. So we need to have an education system that is ready to respond to those issues. But we also need to shift the debate away from risk and from disease to look at well-being and a more positive approach to managing and owning one's sexuality and sexual health. And that's what we've tried to do with this revised edition of the technical guidance. And that is in response to the consultations and the discussions that we had with young people during that process. For some of you, if you are familiar with the old definition of CSE, you'll see that the revised definition is much more expanded. It takes into account those notions of a positive approach, the process of teaching and learning, and it's a complex definition, and it took a long time to establish, and a lot of partners from different sectors and young people were involved in the development of that definition, but it is now what we, as the UN, stand behind as what we believe should be good quality, comprehensive sexuality education. A quick comment on age. This is actually taken from a framework for work that was happening in East and Southern Africa to help policymakers understand why CSE and sexual and reproductive health services are important for young people. For us, starting at the age of 5, at the beginning of primary school, is critical because that's when education starts. And education about health and about skills and about your body need to start when all of the rest of your learning starts. There's no reason to annex it off and start it later. I think there's a lot of debate and discussion to be had about what's appropriate. And what we know is that, for example, gender norms are concretized at a very young age. Habits in terms of one's relations, habits in terms of one's health-seeking behavior start at a young age. So content to 5 to 9-year-olds might be what we consider to be traditional wash subjects. Have you washed your hands after you've been to the bathroom? How do you talk to your friend in your classroom next to you who's the different sex to you? Do you treat other people with respect? And also, how are you taking on board and critically engaging with the information that you're hearing on the radio or on the internet or in your place of worship or in your family? So that for us is also why it's important to start young. One very important aspect for us to take away is that evidence is increasingly showing that gender is at the heart of successful CSE. If you want to have an impact on the health outcomes, and that's the only thing that have really been measured, that's the only thing that people have invested in measuring. So if you want to know whether CSE is reducing pregnancy, reducing HIV, improving uses of condoms, you have to have gender at the heart of it. And transforming those harmful gender norms means that young people are more able to act on that information and have the agency that's needed for their healthier, safer behaviours. And I just want to make a point that when we talk about gender in the technical guidance, we have tried our hardest not to take a heteronormative approach, but to recognise gender diversity. And that is a challenge in a lot of countries, and it's certainly not something that we would force anyone to talk about if it's illegal or dangerous, but it's an important international concept for us to maintain. Very quickly, an example of what intersectoral collaboration can look like and how you can get improved connections between health and education. East and Southern Africa. In 2013, we worked with countries and with a lot of other agencies and colleagues to support countries, ministers of health, ministers of education, to endorse a ministerial commitment to deliver sexuality education and sexual and reproductive health services for young people. Sometimes you need political leadership to drive change. You need a minister to stand up and say, this is what our country is committing to doing. These are the targets we're going to commit to. Now, please go ahead and doing it. I can't tell you how many times I've heard from people within ministries of education, well, it sounds really good, but I'm not really sure we're allowed to work on that topic. If you don't have the leadership from the top, you're not going to achieve anything. You need targets. You need something to work towards. So the ESA commitment has very, very clear and defined targets. 2015, our medium term, and by 2020. They're aligned with existing targets within different frameworks, including the SDG frameworks. And they're pretty ambitious, because without the ambition, we wouldn't be driven to make the change. And then at the country level, you need to have accountability. You need a framework, you need a work plan, and you need mechanisms. So there's 21 countries that endorse this commitment. In every single one of these countries, there is some kind of a task team that is responsible for measuring the progress, where people from the Ministry of Health, the Ministry of Education, civil society, UN partners and donors sit together and say, how have we done on this? Is CSE being delivered? Are sexual and reproductive health services being delivered according to the agreements that were made? And it's only by bringing those people together, and maybe that committee already exists, and maybe in some places it's newly grown. And finally, thinking of complexity, you need a huge number of players involved. And this is just an example of the number of partners that are involved in making that commitment come to life. So at the very top, you've got the logos of the regional economic communities. They're the linchpin, they're the keys where the member states discuss their responsibilities, discuss their policies, and without them, this work wouldn't be able to drive forward. We've got multilateral partners, the UN agencies, we have donors in there, we have civil society, young people, and there are people funding this work, because it could not happen without the investments from a range of different sources to make sure that curriculum are improved, teacher training is delivered, health force training is delivered, and services are improved and commodities are available. So embracing complexity is hard, but it has to be done, and I think that's the only way that we will embrace change. So to conclude, I think we have to move out of our vertical boundaries. We've heard that it's important to have sectors, because you need specialisation, you need people who understand the sectors, but we have to think of what an adolescent or a young person needs, how they view the world, and then organise our responses to that young person's needs. And education and health aren't terribly separate for them, so we need to find a way to bring those issues together in a way that's accessible and meaningful for those young people, so that they can affect the change in their life that they need, and the environment that they're living in is safer and more conducive to that outcome. Thank you.
Thank you. Joanna, I saw you nodding vigorously in the early part of that response. I'm going to ask you to come in, but I also wanted to link it, if it could, to the issue of community engagement and gender norms, particularly when it comes to comprehensive sexual education, and looking at how the role of the community can help perhaps disrupt some of the traditional ideas and associations, not just about girls, but also about boys and health.
Thank you. I'm not sure what I was nodding at. I think I was nodding at human resources as it grew and then it lost, which I think is a real shame. I don't, for me, coming from an education perspective, and I think I would stand behind what Ibrahima said, and you can't deliver a service, you can't deliver public goods without people capacitated, competent, and within a structure to be able to do that. So from where we stand, I would say that if you invest in one thing to shift the way that health education is delivered, and I think I'm talking here about something different perhaps from the infrastructures or the WASH facilities or the feeding programs, for example, but health education, the only place to invest there is in the people who are delivering that education, and the training, but also the support. And in the interviews and the research that we've done with teachers, is the questions that come up are around how much time they have to deliver those lessons. If they're not at the heart of the curriculum, are they being examined? Are they not being examined? Those particular subjects, and how that becomes prioritised. But where it links to community engagement is that in some cases, although not as much as I think people might imagine, teachers are nervous about teaching certain issues because of the fear of parental or community backlash. And actually, I think what's been interesting in recent years is seeing some of the data around the support that parents have for younger adolescents to learn about condoms in school, for example. And those numbers have been rising over recent years. So actually, interestingly, it's the practical questions about, do you have space in the curriculum, and do you have the competence to teach these issues, that is more relevant to teachers in the classroom than whether the parents or the communities there may be complications. That's not to say that it isn't critical to also look at how that young person is moving between what's happening at school, what they're learning in their peer group, and at home and in their community. Those things are really influential, and they're particularly influential on gender, where where gender norms are being learnt by what they see. So working with teachers to look at their teaching practice, to think about how gender equality is being modelled in the classroom is really important, and whether girls and boys are being treated differently in the classroom and the expectations are different.
Okay, my name is Samuel van Stertigem. I'm a Belgian pediatrician, and I've been working in Rwanda and now in the Belgian health sector. My question is probably to the whole panel, but maybe more specifically for Joanna. I understand you've been talking a lot of the importance of bringing health and health intervention in the education sector. The last question to the audience reflected that importance, because that was the top priority, was an example like that. But I would also like to point out the importance of bringing education in the health interventions. And that if you take the example of nutritional problems, maybe more for overweight, that is also a burden for low and middle income countries. At the age of 5, when education starts, things are already too late and the damage is done, and the intervention should come first. So I would like to also insist on the importance of intervene actually before, when you take care of the families and of the young parents in the health consultations.
Thanks very much, and I think it's a really, really important question. And the idea of bringing the two pieces together should absolutely be that there's movement in both directions. From the perspective, just to give an example of sexual and reproductive health, I would give the example of a country like Estonia, that after its independence, and it was redeveloping its education program, and recognised that sexual and reproductive health was an important part of that educational program. They made efforts to make sure that education about sexual and reproductive health and sexuality education was integrated as not as an intervention, because interventions aren't education, that's a health word, but they were part of education, but that they made sure that health visitors would come in at regular times to schools to complement the education that teachers were giving, and that young people would be taken at regular times to visit youth-friendly health services to kind of lower the barriers to accessing those services. And the health service providers were all trained not only in service delivery, what commodities do you need contraception, but in the kind of discussion and pedagogical processes and the kind of information and educational processes. So there was a sense that everybody had to contribute to similar goals, and there was this movement between education and health. It's a fantastic model. Other countries are looking at it too, but it should be part of both sides of the puzzle.